And welcome back. Tobacco use remains the leading cause of preventable death in the United States, claiming over the lives of almost 500,000 people each year. In New York City alone, around 12,000 residents die annually from smoking-related illnesses. And despite significant progress in tobacco control, disparities still remain, especially in low-income neighborhoods and communities of color, where access to smoke-free housing and protection from secondhand smoke are still not guaranteed. Join me now to share more. We've got the NYC Smoke-Free's Reality Check Youth Engagement Manager. We've got Zoe Cruz. And then we've got the Bronx and North Queens Community Engagement Leader, Frederick Marte. And thank you so much for being with us.
Thank you. Thank you for having us.
Yeah, so when we look at the numbers here, I mean, obviously they are concerning. To see that numbers are on the rise. From you who have the boots on the ground, tell us about how we're dealing and how New York is actually faring, city is faring when it comes to smoking. And I'll start with.
Yeah, so in terms of smoking, I know recently in 2022, there was a study that found that over 49.2 million, or 1 in 5 adults, claim that they use tobacco products. And in our work, we've worked on this for about 10 years, and we've seen a decrease in the use of these products. But this is still a relevant issue. Like you mentioned, in marginalized communities specifically, those communities were targeted, and these products still persist in those communities, specifically when we talk about youth. So we have seen a decrease in adult smokers, but then we've seen an increase in youth smokers starting as early as elementary school.
Right. That brings Zoe in, and then dealing with the youth, really trying to get them on board with understanding the ramifications and early engagement and what that leads to. So your job and your task is what?
So as a youth engagement manager, I pretty much work to equip the young people with the tools and knowledge needed to resist the tobacco industry's manipulative marketing tactics. So pretty much setting them up for success so that they know the information and can move forward in being pretty much champions in tobacco control.
Yeah, so when we talk about protecting youth, what are some of the ways that you're going about really getting that message to them, letting them know about the harms and the effects?
I like to approach with creative activities, very hands-on, posters, projects, going out into the community, doing bud pickups, really having something visual for the youth to look at so that they see that this is a physical thing, that they can look at it, they can smell it. If we collect a whole bunch of buds that stinks, they can smell it, they see that it's in the environment. So something that they could really look at.
Yeah. For yourself, obviously, doing the work, really trying to make sure that more people become, you know, the smoke-free engagement, if you will. Talk to us a little bit about that side of really sharing and the things that you're looking at in terms of like health equity, trying to see that make sure that when it comes to this issue, that there's some equality that's across the board.
Yeah, I think when we think of equity specifically, we look at low-income communities, specifically looking at Black and Latina families. When we look at the work that I do, working with trying to get voluntary policies passed, specifically in housing, I look at affordable housing and how these individuals in the past didn't necessarily, you know, because they're multi-unit housing, secondhand smoke is easier to travel between those units. So really educating them on certain myths, because there's still individuals who don't think that smoke does travel within those units.
So your work takes you between the Bronx and Queens as well, huh?
Yes, it does. So there's a lot of traveling, but it's really good because we get to see different challenges and different issues. Like you mentioned, health equity is something we have to connect our work with, because a lot of times when we talk about tobacco control, specifically in these marginalized communities, it might fall to be a low priority unless we're connecting them to those issues, right? Because when we're thinking about economic stress and housing inequality, they might be more concerned and more worried about those things at the time.
And your work coincides because, you know,
Yes.
on one side, I'm thinking about, hey, you've got a lot of tobacco use that's now flowing in, particularly in marginalized communities. But then not only do you have tobacco use, you have a lot of tobacco marketing. And so how do you counter the marketing that's out there? Because we know it's coming hot and heavy.
I would like to say with the youth programs or the youth meetings, we pretty much counter that by making our own material that really works to inform young people and their peers. So, for example, poster making is something that I really like harness into, because then the young people could create their own messaging around it, and using that to kind of also just put that out there. When we know that youth are walking down the street, they're seeing the smoke shops, they're almost everywhere, and trying to have that same stuff in, not the same stuff, but their work in schools, so that the youth who go into school, they can see, oh, my peers are telling me and showing me like how not to smoke and how not to start smoking.
Yeah. So as I think about some of the things that you've got going on, you know, I know that you've got a couple of events coming up, and
Yes.
one taking place on the 30th, and that one is designed to really get some community engagement and let the community know. But share a little bit about the event on the 30th.
Yeah, so we've partnered with individuals who've been doing this work for a really long time. We're partnering with the Poet Life, who works with local artists to hold poetry events, as well as Dr. Garner, who is an individual that speaks specifically about the issues regarding menthol in African American communities. And the event itself, it's a menthol poetry event. So we're going to have youth and local artists talk about the disparities and harms that are caused by tobacco product use through art and advocacy.
Yeah. You brought up two things, menthol, right, and then secondhand smoke. What can you give us in terms of menthol that maybe the public may need to know about when it comes to menthol?
Yeah.
Anybody?
So menthol, specifically menthol cigarettes, they were pushed in marginalized communities, specifically the LGBTQIA+, African American, and Latinx communities. It's important to know that you know, specifically in African American communities, menthol cigarettes are sold at a cheaper rate than in other communities. And 85% of African Americans who smoke actually smoke menthol cigarettes, resulting in about 50,000 or around 54,000 African Americans that die yearly related to diseases caused by smoking.
Yeah. I'd like to ask you a question about receptivity, because when you're out there talking to young people, we're talking about smoking.
Yeah.
You know, don't stop smoking. You know, come on now. Bruh. You know, I can hear the answers, right?
Yes.
That's what you're getting at, bro. So how is it on the trail when you're out there talking to young people, trying to engage them in this area? What are they saying?
So I like to start with thanking them for even being there, depending if it's a presentation
That's
or even
nice.
like,
Good. Yeah, all right, that's a good start.
Yes, I definitely thank them for being there, and as well as thanking them for listening to any of the information that I'm coming. I do get met with some pushback, but I think that having the conversation about smoking is having a conversation about survival. At the end of the day, these kids are growing up and they're seeing some of the marketing, they're seeing some of the things that are coming into their life, and these are health choices that will affect them for the rest of their lives. So I kind of frame it around that, like, this is a choice that you're making for your health. A lot of the times young people don't want to listen to adults, they don't want to hear that influence coming in, and the tobacco industry is an influence that is coming in. So letting them know that kind of breaks that barrier.
Yeah. Frederick, I want to ask you about this, because there's a lot of advocacy that's going on, a lot of people making pushes in state and local. How involved are you and engaged in you with the advocacy portion of really getting that up the chain to, you know, state legislators, governor, the whole 9 yards?
Yeah, so we focus specifically on education and awareness. So what we do in going out to these spaces is educate on the disparities and really hone in on lived experiences, statistics, and facts from individuals such as youth leaders in our reality check program, or community leaders, or other organizations, to really bring these elected officials their word of what's happening in their community, so that they're better informed about what's happening by those most affected by this issue.
And what do you hear when you're out there in terms of what's happening? Is there some common themes that you're hearing about what's out there?
Yeah, I mean, a lot of people are concerned because, you know, I know a lot of times the issue is, you know, with regulating smoking, but they mention, like, you know, we don't care if people do it. What we care about is that I don't choose to do it and it's affecting me. So a lot of time we hear from individuals who aren't smokers and who are smokers bringing up the same issues, right? The way that it affects individuals who choose not to smoke and how those individuals, like children, elderly, individuals with chronic diseases, and even pets, are being affected by another individual's choice.
Well, Zoe, Frederick, gotta leave it there, but thank you so much for sharing with us. Again, the event's on the 30th. Tell them where.
Yes, it is happening at Mother AME Zion Church, and it'll start around 6:30. And again, remember that's where youth and local artists will be talking about the issues we've kind of mentioned today through art and advocacy.
All right, well, thank you for joining us. All righty. Well, listen, now, if you want more information, visit the website at nycsmokefree.org. Encourage you, don't go anywhere. We'll be back with more Open coming up right after this.